What is anxiety and how is it treated? 1. Introduction. Anxiety is a state of nervousness that can range from mild to severe. Everyone experiences anxiety at some point in their lives. For example, you may be worried and anxious about taking an exam, taking a medical test, or going on a job interview. Feeling anxious during such times is completely normal. Some people, however, struggle to keep their worries in check. Their anxiety is more persistent and frequently interferes with their daily lives. Anxiety is the primary symptom of a number of disorders, including panic disorder, phobias, post-traumatic stress disorder, and social anxiety disorder, social phobia. The information in this section, however, is about a specific condition known as a generalized anxiety disorder, GAD. 2. Anxiety disorder in general, GAD. GAD is a long-term condition that causes you to be anxious about a variety of situations and issues rather than a single event. People with GAD are anxious most of the time and frequently struggle to recall the last time they felt relaxed. GAD can result in both psychological and physical symptoms. These differ from person to person, but they can include feeling restless or worried, as well as difficulty concentrating or sleeping. 3. What factors contribute to GAD? The exact cause of GAD is unknown, but it is likely that a combination of several factors is involved. According to research, these may include A. Overactivity in brain areas involved in emotions and behavior. B. An imbalance of the brain chemicals serotonin and noradrenaline, both of which are involved in mood control and regulation. C. The genes passed down from your parents. If you have a close relative who has GAD, you are 5 times more likely to develop the condition. D. Having a history of traumatic or stressful events, such as domestic violence, child abuse, or bullying. E. Having a long-term painful health condition, such as arthritis. F. A history of drug or alcohol abuse. 4. Symptoms. GAD, generalized anxiety disorder, can have an impact on both your physical and mental health. The severity of the symptoms varies from person to person. Some people only have 1 or 2 symptoms, while others have a slew. If anxiety is interfering with your daily life or causing you distress, you should consult your doctor. A. GAD psychological symptoms. GAD can alter your behavior as well as the way you think and feel about things, resulting in symptoms such as restlessness, a feeling of haunting, being constantly tense, concentrating difficulties, irritability. To avoid feelings of worry and dread, you may withdraw from social contact, visiting family and friends. You may also find going to work difficult and stressful, and you may need to take time off from work. These behaviors may cause you to worry even more about yourself and exacerbate your low self-esteem. B. GAD physical symptoms. GAD can also cause a variety of physical symptoms, such as dizziness, tiredness, a heartbeat that is unusually strong, fast, or irregular, palpitations, tension and muscle aches, shaking or trembling, dry mouth, sweating excessively, breathing difficulty, stomach pain, feeling ill, headache, needles and pins, having trouble falling or staying asleep, insomnia. 5. Anxiety causes. If you are anxious as a result of a specific phobia or panic disorder, you will usually be aware of the source. If you have claustrophobia, a fear of enclosed spaces, you know that being confined in a small space will make you anxious. However, if you have GAD, it may not always be clear what is causing your anxiety. Uncertainty about what causes your anxiety can exacerbate it, and you may begin to fear that there will be no solution. 6. Treatment. GAD is a long-term condition, but there are a variety of treatments available to help. Before you begin any form of treatment, your doctor should go over all of your options with you. They should explain the advantages and disadvantages of each and make you aware of any potential risks or side effects. 7. Initial treatment. Initially, your doctor may recommend that you try an individual self-help course for a month or 2 to see if it can help you learn to cope with your anxiety. This usually entails working alone from a book or computer program. You will be given instructions on how to use the book or program before you begin, with only occasional contact with your doctor. Alternatively, you may prefer to enroll in a group course in which you and a few other people experiencing similar issues meet with a therapist once a week to learn how to deal with your anxiety. 8. Psychological treatment. If you have GAD, you will usually be advised to try psychological treatment before being prescribed medication. A. Cognitive behavioral therapy. One of the most effective treatments for GAD is cognitive behavioral therapy, CBT. According to studies of various treatments for GAD, the benefits of CBT may last longer than those of medication, but no single treatment is best for everyone. CBT assists you in understanding how your problems, thoughts, feelings, and behavior interact. It can also assist you in questioning your negative and anxious thoughts, as well as doing things you would normally avoid because they make you anxious. CBT usually entails meeting with a specially trained and accredited therapist once a week for 3 to 4 months. Your therapist should perform CBT in a standardized manner in accordance with a treatment manual, and they should be regularly supervised to ensure that they are providing the most effective treatments. B. Relaxation techniques were used. Applied relaxation is a type of psychological treatment that, when combined with CBT, can be just as effective in treating GAD. Applied relaxation focuses on relaxing your muscles in a specific way during stressful situations. A trained therapist must teach the technique, but it generally entails understanding how to relax your muscles, learning how to quickly relax your muscles in response to a trigger, such as the word relax. Practice relaxing your muscles in stressful situations. Applied relaxation therapy, like CBT, usually entails meeting with a therapist once a week for 1 hour for 3 to 4 months. 7. Medication. If none of the above psychological treatments have worked for you, or if you prefer not to try them, you will usually be offered medication. A. Selective serotonin reuptake inhibitors, SSRIs. In most cases, the first antidepressant medication you will be prescribed is a selective serotonin reuptake inhibitor, SSRI. This type of medication works by increasing the amount of a chemical in your brain called serotonin. Sertraline, escitalopram, and paroxetine are examples of SSRIs that may be prescribed to you. Long-term use of SSRIs is possible, but as with all antidepressants, it may take several weeks for them to begin working. Typically, you will be started on a low dose and gradually increased as your body adjusts to the medication. Feeling sick is a common side effect of SSRIs. Drive with low sex, vision impairment, constipation or diarrhea, dizziness, arid mouth, appetite loss, sweating and agitated, sleeping difficulties, insomnia. Some side effects, such as feeling sick, having an upset stomach, having trouble sleeping, and feeling agitated or more anxious, are more common in the first 1 or 2 weeks of treatment, but they usually go away as your body adjusts to the medication. If you or your doctor believe that your medication isn't working after about 2 months of treatment, or if it's causing unpleasant side effects, your doctor may prescribe a different SSRI to see if it helps. B. Serotonin and noradrenaline reuptake inhibitors, SNRIs. If SSRIs do not relieve your anxiety, you may be prescribed a serotonin and noradrenaline reuptake inhibitor, which is a type of antidepressant, SNRI. This medication raises the levels of the chemicals serotonin and noradrenaline in your brain. Venlafaxine and duloxetine are 2 SNRIs that may be prescribed to you. SNRIs commonly cause the following side effects: feeling ill, headaches, drowsiness, dizziness, arid mouth, constipation, insomnia, sweating. Because SNRIs can raise your blood pressure, your blood pressure will be monitored on a regular basis during treatment. As with SSRIs, some side effects are more common in the first 1 or 2 weeks of treatment, such as feeling sick, having an upset stomach, having trouble sleeping, and feeling agitated or more anxious, but these usually subside as your body adjusts to the medication. C. Pregabalin. If SSRIs and SNRIs do not work for you, you may be prescribed pregabalin. This is an anticonvulsant medication that is used to treat conditions such as epilepsy, a condition that causes repeated seizures. It has, however, been shown to be beneficial in the treatment of anxiety. Pregabalin side effects may include drowsiness, dizziness, weight gain and increased appetite, vision impairment, headaches, arid mouth, vertigo, the sensation that you, or the environment around you, is moving or spinning,